happens. There we go. All right. Hello, everyone, and welcome to the Medical Equipment World and Healthcare Get the Scoop podcast. We are here to break down durable medical equipment, patient care, and real-world solutions for caregivers, families, and healthcare professionals. I am your co-host, Tara, and Silas is here today also. We're your certified deal and medical equipment specialist and founder of CFS Medical Supplies and Equipment, CFS Solutions. Whether you're new to the DME or a seasoned provider, this show is here to give you insight, tools, and stories that matter. So we're going to just read a quick disclaimer today. The information shared in this podcast is for the educational and informational purposes only, and is not intended as medical advice. Always consult with a qualified healthcare professional regarding any medical decisions or concerns. Neither the host nor guest assume liability for actions taken based on content discussed in this episode. And so today we have the wonderful, great Dr. Sota and Wikwi. I hope I said that right, and I didn't mess up your the name, Doctor.
Sota or Omoigu.
Okay. So can I just say Dr. Sota?
Yeah, that's fine.
All right. Okay. All right. So I'm just going to read off his bio. So Doctor is the medical director of the LA Pain Clinic in Hawthorne, California. He is board certified in anesthesia with subspecialty certification in pain medicine. He has served as an advisor to the United States FDA Advisory Committee and anesthetics and life support devices. His research work in pain pharmacology, anesthetic and pharmacology, inflammation, and the inflammatory response has also greatly impacted the medical field. Dr. Sota is the best-selling author with drug handbooks published in 6 languages: Indonesian, Italian, Japanese, Malaysian, Polish, and Portuguese. Okay, doctor. And used by pain specialists and anesthesiologists all over the world. In his seminal book titled The Biochemical Origin of Pain and published in 2002, he proposed his theoretical law that the origin of pain is due to inflammation and the inflammatory response. His subsequent publications of his theory as a journal article in 2007 has been cited as of this date of 415 medical publications in Google Scholar. Developed the golden half hour oxygen therapy for sickle cell crisis prevention. Doctor holds multiple U.S. patents in medical technology, and he is the co-author of the Nigerian National Anthem. Doctor, we are just excited and honored to have you today on this podcast. So thank you so much for joining us here today. And so we'll just go right into it. And so let's get into this conversation about the golden half hour oxygen therapy.
Okay, thank you very much, Tara. Sickle, the recorded history of sickle cell goes back 7,300 years. And so my discovery is the first solution to prevent and stop a sickle cell crisis in the golden half hour. And my slide presentation will go through that. And what is important here is that the key thing of this is that when oxygen is administered in the hospital, when patients are already in a crisis, oxygen does not work because the cells are already in an irreversible crisis. Oxygen, essentially home oxygen, administered in the golden half hour, the first 30 minutes of a crisis, can stop the crisis, can prevent the crisis. And I'll go through the science of all of that now when I share my screen.
Okay.
Yes. So home oxygen can be obtained by an oxygen concentrator or by an oxygen cylinder. So let me share my screen and go through my presentation.
Okay. And then one more thing, doctor, what is the golden half hour? Like, is that like a specific time of the day?
No, the golden half hour is 30 minutes within 30 minutes of onset of pain or of any of the symptoms of a sickle cell crisis. And I will explain that in this presentation now.
Mhm.
So the key thing, I unveiled my discovery on July 4, 2024. And the key statement in this discovery for patients with sickle cell is let oxygen be your medicine. The sun has risen after 7,300 years of darkness. I'm going to play a video for you to show the significance of this discovery.
7,300 years. Oof. Goodness.
It's a very long time.
Yes, it is.
Mute your microphone.
Revolutionary discovery in the prevention and treatment of sickle cell anemia crisis. By Sota Omoigu, MD, Hawthorne, California, author, The Inflammation Theory of Pain. On July 4th, 2024, Dr. Sota Omoigu, a recipient of the US FDA Advisory Committee Service Award for service to the people of the United States of America, discovered and unveiled the first new intervention in 100 years of modern medicine and 1,000 years of human history that is 90% effective in preventing and aborting a sickle cell crisis within the golden half hour. The sickle cell mutation can be traced back to at least 7,300 years. The first recorded cases of sickle cell disease were in Egypt during the pre-dynastic period, about 3,200 BC. In the Persian Gulf during the Hellenistic period, 2,130 years before present, and in Ghana in 1670 AD. For thousands of years, sickle cell disease has been an inevitable sentence of recurrent excruciating pain crisis, resulting in complications, severe disabilities, and death. But Dr. Sota Omoigu's discovery has come to offer a solution to a problem. That is 7,300 years old. As Hippocrates stated in 400 BC, "Let food be your medicine," Sota Omoigu MD declares in 2024 AD that the guiding principles in the management of sickle cell disease shall be: let oxygen be your medicine, whether provided by inhalation or at the molecular level. Dr. Sota Omoigu's discovery, the science and the solution. History. Sickle cell disease was first described by Herrick in 1910. 1927, Hahn and Gillespie suggested that hypoxia or low oxygen caused the sickling of the red blood cell. 1930, Scriver and Waugh in Canada reported that the number of sickle cells in the blood may be varied by the change of the partial oxygen, O2 pressure. That this is a reversible reaction. Red blood cells need to squeeze through pores that are only 4 microns wide. When oxygen is removed, some of the cells sickle and get stuck. Once oxygen is reintroduced, the unsickle process occurs, and the cells now flow normally through the pores. Reversible and irreversible sickle cells. Reversible sickle cells, RSC, can become irreversible sickle cells, ISC, after repeated episodes of sickling with damage to the cell membrane. The reversible sickle cells can revert to their original flexible discoid shape when reoxygenated, but repeated sickling can damage the cell membrane and make it impossible for the cells to return to their normal shape, becoming irreversible sickle cells. Oxygen therapy in the golden half-hour onset of a crisis restores reversible sickle cells and prevents them from progressing to a critical mass of irreversible sickle cells, wherein the sickle cell crisis becomes established and intractable. Developing a medication to prevent and stop a sickle cell crisis within the golden half hour has defeated the best medical scientists, the best and most resourced pharmaceutical companies, and the best researchers worldwide. The efficacy among Dr. Sota Omoigui's patients has been 90% for prevention and aborting a crisis in the golden half hour. And when you stop the crisis, you prevent the severe pain, emergency care, hospitalization, and multi-organ damage. Should you miss the opportunity to abort the crisis in the golden half hour, subsequent administration of oxygen in a hospital has no effect on the irreversible sickle cells. It just prevents any reversible sickle cells from progressing to irreversible cells. So it only helps to a limited extent in an established crisis. The irreversible sickle cells have to be removed by the body through the process of hemolysis, phagocytosis, or sequestration. It is also necessary to address other factors that may have initiated or are now aggravating the crisis, most common of which is infection, including malaria, pneumonia, etc. References for more information, consultation, or to arrange presentations, contact Dr. Sota Omoigu by email at medicinechief@aol.com.
Okay.
Wow.
That's the first
Very
presentation.
Thank you, doctor, for sharing that. Oh my gosh,
Wow,
that's amazing. Doctor, can I ask you a question on this now? My understanding is the annual birth rate for sickle cell is around 300,000 in babies. Is that accurate?
Yes, that's about it. Yeah.
Wow. Oh my God. I'm sorry. Go ahead, doctor.
I believe that's probably worldwide because in the US, we have 100,000 sickle cell patients. In Nigeria alone, we have 5 million. And Nigeria is about the epicenter of sickle cell crisis. But we still have a huge problem here of 100,000 people with sickle cell. But my discovery has come to change that. It has come to make it a manageable illness. And I will go through it now.
Okay.
So what's the underlying pathology of sickle cell disease? The sickle hemoglobin has a low tolerance to hypoxia. That's a medical term for low oxygen environment. And in a low oxygen environment, the sickle hemoglobin undergoes polymerization, which is just a big medical term for sickling. Essentially, it forms like a gel shape and it changes shape to a sickle shape. And that sickle shape does not allow it to pass through narrow blood vessels. Now, the key thing in this that has been missed for the last 100 years, and of course 7,300 years, is that initially the sickling is reversible. So the sickling process is like the sickle hemoglobin cells are dying. But if they see oxygen, it's like they are resuscitated. They revive and they get back to what they were doing before, flowing through the blood vessels. So this is why in this flow chart, I show what is critical here. Hypoxia, low oxygen environment causes reversible sickling. If within 30 minutes of the symptoms of sickling, which is pain in the joints or organs, the patient is able to put on their home oxygen. That's within the golden half hour. They can restore those cells back to normal. It's like they're giving the cells a breath of life. However, if that doesn't happen after the golden half hour, by the time they get to the hospital 1 or 2 hours later, the sickling has become irreversible, the cell wall is damaged, and the cells have died. Oxygen cannot revive dead cells. And this is why this disease has misled medical science for 100 years, because they give oxygen in the hospital and say, oh, it doesn't work. But they fail to take into account the basic science of the sickling process. And this basic science has been in journals for the last 100 years. What I came to do was to connect the dots like a jigsaw puzzle, assembled all the pieces and created a picture of the problem and the solution. So by the time they get to the hospital, the cells are irreversibly sickled. They die, they obstruct the blood vessels, and that's what causes the severe pain and organ damage. Now, the body doesn't want to see dead cells obstructing the blood vessels. So what does it do? It tries to destroy them. That's called hemolysis. When it destroys them, it decreases the hemoglobin, causes severe anemia. You look at the top of the screen, and that's where all the complications now come. They need a blood transfusion, or if they don't get a blood transfusion in time, they die. Again, the obstruction of the blood vessels, you look at the middle screen to the right, causes severe pain. And if there's inadequate pain control, there's chest splinting, which means patients having shallow breathing. That causes decreased oxygenation. That gives you more hypoxia, more sickling, ends up with an acute chest syndrome. That causes lung damage and death. Acute chest syndrome is responsible for 25% of the mortality. But before my discovery, there was no process to prevent sickling. I've come to show the way to the world that sickling can be prevented in the first place, so you don't have to get into this complication and death spiral of irreversible sickling. So this is 100 years of research again. The sickling is reversible with reoxygenation. When time progresses, the cells become irreversibly sickled. They do not respond to oxygen when they die. They die, create an inflammatory reaction, and obstruct blood flow, causing severe pain and oxygen damage. I'm going to play a video that was put out by MIT in 2015. The purpose was to analyze anti-sickling drugs, but they failed to see the clinical correlation of reoxygenation of reversible sickle cells. So I'm going to switch to the video.
Okay.
So it talks about sickle cells can squeeze through most blood vessels, but they encounter problems when they enter very small capillaries. And a vaso-occlusive crisis is a painful attack that patients with sickle cell disease often suffer from when their sickle-shaped blood cells get stuck in tiny capillaries. So researchers in MIT, Carnegie Mellon University, and University of Pittsburgh developed a tiny microfluidic device to analyze the behavior of blood from sickle cell disease patients, which could be used to predict a vaso-occlusive crisis. Vaso-occlusive means obstructing the blood vessels. So here the researchers show under controlled gas environment how certain cells react to the removal of oxygen, allowing them to identify which cells are potentially more dense, essentially sickling, and cells that are less dense and get sticky with removal of oxygen. So here they're just showing how they alter the oxygen environment. So here now they're showing the sickle. These are the red blood cells. The sickle blood cells, when there's a low oxygen, begin to get stuck in the capillaries. You can see some of them on the right side. The other cells are normal and go through the capillaries easily, but the sickle hemoglobins get stuck, especially in a low oxygen environment. Now, at this phase, they are still reversible. It's almost like they're dying and you're going to give them CPR. Once oxygen is introduced, they get back to normal, they recover, and they get back to their journey. And this is the key aspect of this discovery, that the initial phase of sickling is reversible. at home, not in the hospital. So these methods were developed for evaluating the effectiveness of anti-sickling drugs like hydroxyurea. Okay, I'm going to go back to this.
Wow. Oh my gosh. Okay, so doctor, question.
So,
Okay, I'm sorry, go ahead.
yes. No, go ahead.
So my understanding when I was just kind of looking over things, it says that a lot of times people are misdiagnosed or they're not diagnosed even if you're an adult. Like, so how does that work? Like, do they test? Is that a natural thing that you just ask for a test for? How do you know if you have sickle cell? Like, how do you even know? Like, I know.
Well, the symptoms manifest right from infancy, right from being babies. They start having joint swelling and they start having severe pain. Then they are tested, their hemoglobin genotype is tested, and we show that they have SS or SC or S thalassemia. So no, they know. Yeah. The symptoms are very severe. So it's not something that will be missed.
Oh, wow.
That's like even in sports. Like I remember in college, like my first year in college, like we had to go through our health screening. One of the main tests was the sickle cell. We had to get sickle cell tests, like for the first 2 years of college, right? And so I wonder, is that also? So I wonder, with sickle cell tests, so why is it that athletes would have to get screened for sickle cell as well?
Well, they're actually not being screened for the full sickle cell syndrome, SS, which manifests severely and very early. They're being tested for the sickle cell trait, which is like AS. So, which in some athletes, after very, very vigorous exercise, they begin to exhibit symptoms. So, in the military, they now test for sickle cell trait. That's what they were testing you for.
Oh, and that was actually my next question. I was going to ask you the difference between the sickle cell trait versus a sickle cell disease.
Well, yeah, you get the trait if you get one A from one parent and an S from another parent, which is different from the full-blown disease when you get an S from each parent, which gives you SS, or an S from one parent, a C from another, which gives you SC.
Oh,
Okay.
so does the
Okay, that makes
trait
sense.
with the sickle cell trait cause you to have some type of pain too, or is it just then only when you have the disease?
No, only when you have the disease. The sickle
Oh,
cell trait may cause pain only on extremely vigorous exercise. That's why they're testing athletes and the military.
oh, that makes
Okay, that
sense.
makes sense now. Yeah.
Wow.
Yeah.
Okay.
This
All
is
right.
Very, very, be very deep too. And something that like they don't is, and this is another thing yet that's not really talked about too much, is sickle cells, this topic.
Well, because there was no solution before this. So I just described this solution on Independence Day, 2024.
Wow.
So that was Independence Day for the United States and Independence Day for sickle cell patients.
wow. That is wow. So whew. Wow. So the results that you have observed for patients utilizing home oxygen therapy for sickle cell management, I know because I've seen a video of a young girl, and I was like almost in tears for her because she was saying she was in a lot of pain, and then after she used the oxygen, you could just see the smile on her face, and I was like, oh my God, like it was very emotional, very touching.
And that's because she got to the oxygen within that golden half-hour period.
Wow.
If she had missed that time window,
Mhm.
you're looking at a 1 to 3 weeks hospitalization. You're looking at complications, blood transfusions, organ damage, and death.
Gosh. Wow. Wow. So how do you envision the integration of this therapy into standard sickle cell treatment protocols, like going forward, since though everyone's kind of like getting aware of it now, right? So what do you
Okay, let me just go through very quickly a few things in the presentation.
Okay.
The history in 1910, sickle cell disease was first described by Herrick. 1927, we're in 2025 now, almost 98 years ago. Han and Gillespie suggested that hypoxia or a low oxygen environment causes sickling. In 1930s, Scriver and Wow reported that the number of sickle cells in the blood may be varied by the change of the oxygen pressure, and that this is a reversible reaction. So I'm just going through these studies so you can see that these studies have been there all throughout. 1983, Frank and Chu say that deoxygenated reversible sickle cells possess the ability to readopt their normal discoid shape upon reoxygenation. 1991, Robert Hebel said that the damage to the cell membrane is reversible with reversible sickle cells. Again, we just watched this video by Melanie Gonick in the MIT. And then there was a clinical trial, August 1992. Ziposki et al. In Toronto studied the effect of oxygen therapy on the number of irreversibly sickled and reversibly sickle cells in patients with sickle cell anemia. They found that inhalation of 50% in patients who were not in a crisis produced a significant fall in reversible sickle cells, but lesser in irreversible. Inhalation of 50% oxygen in patients who were in a crisis showed a significant reduction in reversible sickle cells, but not in the irreversible. It was too late for those irreversible sickle cells. In the group of patients that received air, no supplemental oxygen, there was no change in the reversible or irreversible sickle cells. So this shows that in patients already in a crisis, even though the reversible sickle cells were reduced, there was no difference between the air and oxygen groups in the duration of severe pain, opioid administration, and hospitalization. So as I've mentioned before, oxygen therapy when a sickle cell crisis is already established does not affect the population of irreversible sickle cells. The body has to destroy those because those are just blocking the blood vessels and has to be destroyed by hemolysis, phagocytosis, or sequestration. And that's the cause of the drop in hemoglobin and severe anemia. So the summary, reversible sickle cells can become irreversible with cell membrane damage and cell death after repeated episodes of sickling. However, while they are still reversible, they can revert to their original flexible discoid shape when reoxygenated. So in 2024, I came up with my discovery, taking oxygen therapy in the golden half hour based on my clinical experience with patients. Within 30 minutes onset of the crisis, restores reversible sickle cells, prevents them from progressing to a critical mass of irreversible sickle cells, wherein the sickle cell crisis becomes established and intractable. So if we can reverse the low oxygen environment by providing home inhalation oxygen within the first 30 minutes of the sickle cell crisis, we can stop the crisis. And when you stop the crisis, you prevent severe pain, hospitalization, and multi-organ damage. Now, why did we miss this solution? Because by the time the patients seek medical care or arrive in a hospital, they're already experiencing irreversible sickling. We can no longer be reversed by oxygenation. So the doctors see this patient in the hospital, they put on oxygen, doesn't make a difference. They say, well, oxygen is of no use. But they miss the timing of it. And if this time-dependent golden half hour for sickle cell is similar to the golden hour for stroke, when there's the best chance of restoring blood flow and saving brain tissue, or that for myocardial infarction, heart attack, where timely intervention impacts a patient's survival and quality of life. In the last 20 years, we have been able to reduce incidence of sickle cell crisis in our patients, as well as hospitalization, by 90%. 90%. The key to this disease is preventing or stopping the crisis at the first sign of the crisis. So where does the majority of sickle cell crisis occur? And by the way, people can go to my website, sicklecelldiscovery.com, where I have various materials, videos, podcasts for education for both patients and physicians. And also I have a link to our WhatsApp sickle cell discovery platform. Where does the majority of crises occur? during sleep. Sleep is the most dangerous time for a sickle cell crisis. And why? Because in the supine position, when you're lying down, there's shallower breathing when lying down, and nasal vascular congestion, which reduces the airflow in the supine position. So that's why most of the crises occur during sleep. But patients never knew, and their doctors didn't know that either. Patients with sickle cell disease were afraid of going to sleep. They thought there was a demon that comes to them at 2 to 3 in the morning. But it wasn't a demon. It was nocturnal hypoventilation, also known as nocturnal hypoxemia, you know? So, and in another study, in 2003, Hargrave et al. Concluded that low nighttime oxygen saturation was highly significantly associated with a higher rate of painful crisis in childhood. And just last year, Chang et al. Found 43% of sickle cell patients had sufficient nocturnal hypoxemia to warrant oxygen therapy. They concluded that oxygen therapy may decrease inflammation and oxidative damage in hypoxic individuals. So a low oxygen environment is made worse when there are one or more triggers, such as increased anemia, pain, stress, fatigue, exertion, infection, increased sedation, alcohol, a high altitude greater than 2,000 feet. Las Vegas is slightly above 2,000 feet. Cold environment, the feeling of being unwell. So when patients have a daytime trigger, we advise that they sleep with oxygen, because then that's when they're going to be at the greatest risk of a crisis. In the absence of triggers, they don't have to sleep with it. But when they sleep with it, 100% of the time, they're not going to have a crisis. Should they wake up in the crisis, they should merely turn on the oxygen cylinder or concentrator and apply oxygen within the golden half hour to abort the crisis. So, the other danger for sickle cell patients is air travel and high altitudes. So during and following commercial airline flights, patients with sickle cell disease are known to experience complications such as bone pain, splenic infarction, the vascular necrosis of the hip, and in some cases, prolonged crisis resulting in death. Some have died in the aircraft. So these complications have been linked to prolonged oxygen desaturation at high altitudes, with oxygen saturations measured as low as 77% instead of the normal of 95 to 100%. And most notably, desaturation occurs within 10 minutes of the aircraft taking off, because aircraft cabins are pressurized to 8,000 feet. So once again, but should the patient have a crisis and they miss the golden half hour, it's important that they get to the hospital. It's important they get treatment for severe pain. Pain control is imperative, because severe pain produces chest splinting, inadequate respiration, further hypoxic sickling, acute chest syndrome, and can result in death. So patients require pure opioid and anti-inflammatory medications like morphine, pethidine, hydromorphone, fentanyl, ketamine, combined with an injectable anti-inflammatory such as ketorolac or diclofenac. Patients should never be given weak opioids like pentazocine or tramadol. That essentially is medical malpractice, because it just doesn't control the pain and essentially will only kill them from acute chest. So, I'm going to just share the cost of a crisis. 2021 study by Holford showed 1.5 billion in lost wages and productivity each year in the US, right, from sickle cell disease. And actually in 2019 study by Finger et al., they found out that in 2016, aggregate costs for inpatient stays for sickle cell disease totaled $811.4 million with an average length of stay of 5 days. with life expectancy in 2005 of 42 years for females and 38 years for males. So you can imagine just an oxygen cylinder or a concentrator for what, 400, 500, 600, or for the more expensive ones, 2,000 to 3,000.
Yeah.
Can save 811, 90% of this cost would be like $700 million savings just by getting oxygen at home.
Interesting that, and it's interesting that the conclusion with this, like basically that can solve and prevent the crisis, just receive something simple, just as receiving home oxygen. That can really just prevent all this. It's just interesting how like simple the prevention is.
Yeah.
Yeah, you couldn't get a simpler solution for a chronic disease of 7,300 years. You couldn't get that. And drug companies have tried and failed in their medications to stop a sickle cell crisis. And there was a drug called Adagvio, and a $665 million drug. But it tried to was based on inhibiting P-selectin, the adhesive molecule where the sickled hemoglobin sticks to the blood vessel. But by that time, it's too late because those cells are already irreversibly sickled. The drug was withdrawn from the market last year, both from Europe and from the United Kingdom. This was a $660 million drug. And the reason why the big pharma drug companies have failed in a solution is because they were looking for a drug when the solution was a gas. There's no drug that has to be swallowed and go through the gastrointestinal system that can reoxygenate sickle cells as fast as a gas. Oxygen acts within a few seconds. And there was another drug that was withdrawn, unfortunately, Oxbryta, which essentially provides oxygen at the molecular level to the sickle hemoglobin. And that drug was a game changer and result in decreased destruction, increased hemoglobin, sometimes as fast, just a few days faster than a blood transfusion. But it was withdrawn because it had like complications of eight patients died, 5 of whom had infections, which really did not make any sense why they withdrew that drug. But also that drug could not stop a crisis. Same thing with Adagvio. It was withdrawn because patients on Adagvio had more crises than patients on placebo because they all missed inhalational oxygen. Just as simple as that. So intervention with home, in conclusion, intervention with home inhalational oxygen that can prevent, and the golden half hour about the sickle cell crisis must be made available and accessible to the estimated global population of 7.74 to 20 million patients with sickle cell disease, and a sickle cell disease mortality burden at 376,000 in the year 2021. So with home oxygen, we can save lives and change lives. Thank you.
Wow, doctor. Oh my God. I am, whoa. So how do you get, I mean, like, so how is the word getting out about this discovery, right? So, because we're in 2025 now. And so what advice would you give to healthcare professionals like other doctors? How do they know? I guess I'm just trying to figure out, like, how do you get the word out so that people will know exactly what they need as far as this, just oxygen. And then my second question is, I know that when it comes to the insurance with oxygen, right, you have to have certain levels and things of that nature to even qualify for it. So is this something being considered that, maybe the insurance companies would start to authorize possibly?
It's a process.
Mm-hmm.
You have to remember that this is a disease of 7,300 years, and the solution was just broadcast last July. So insurance companies are definitely not going to pay for it. But what we have even in Africa, and I've been doing multiple Zoom conferences with doctors, patients from all over the world. So the word is getting out slowly. People are buying oxygen cylinders in Africa. They're buying their own concentrators because they can see the difference.
Right.
The concentrator is like $400, and hospitalization is a whole lot worse. And with organ damage and death, and when you talk of organ damage, you're talking about bone infarction, you're talking about stroke, you're talking about kidney damage with dialysis. You're talking about a lot of terrible things that a simple oxygen cylinder or home oxygen can stop.
Wow. And then another thing too is like another question I have is, are doctors open to that simplicity of just using home oxygen? Like, do they kind of think that, okay, this is the solution, but in their point of view, do they see that that's too simple? Like, I mean, if this is this complicated, this is something that's like using home oxygen is too simple of a solution. It has to be something a little bit bigger.
Well, you see, some will be convinced and some will not. You understand? And there are many who are already convinced, and there are quite a few who are not. You don't come and change the paradigm of 7,300 years without people resisting. And so, but the proof is the patients. No matter all this $665 million Adagio, $5.4 billion Osbrita, when they got to the market, they couldn't stop the crisis. The patient is the ultimate proof. And we have testimonials, written video of patients whose lives have changed. Wow. So you see, the way I look at it here is that the worst they can do here is that they can say they don't believe it, they're not going to implement it. Oh yeah, the science looks good, but I don't think it's going to work. But in the olden days, I'm going to talk about Galileo. When Galileo came and said, the earth goes around the sun instead of the sun going around the earth. That was like heresy in those days. He was hung or killed one way or the other. Same thing with Socrates. So that's a whole lot worse than people not accepting your idea now.
Wow. It's like, yeah, that's very, but with I would say like the light at the end of the tunnel is that is the solution, right? Is that it's not something like, it's not something that you have to go, this complicated procedure you have to do. It's actually just getting an oxygen machine and using that maybe periodically throughout the day, or especially when you're asleep. So that way you can pretty much you can take control back from the sickle cells. Like of course it's obvious that it's not curable, but at least you can control it now.
Well, you see, and the key thing is control. Diabetes was a fatal disease, killed people in 20s and 30s until the discovery of insulin by Banting and Best in Canada in 1921. Once insulin was discovered, it became a curable and manageable illness. So home oxygen is the same thing for sickle cell. It will change this uniformly fatal disease to a disease that can be managed and controlled. And look at all the other diseases. Look at high blood pressure. Yeah. Nobody cures it. You have to take medications every day of your life.
Yeah.
So you manage it. So that's what I've come to bring, to make sickle cell a manageable illness.
It's like, and then with a sickle cell, is that something that is curable? Like if someone was to, use this, use that oxygen therapy periodically, like every day, is it something that could become curable? I mean, if like with that kind of therapy?
No, it doesn't become curable. The only thing that can cure sickle cell is bone marrow transplant or gene therapy. For gene therapy, they can only do 75 patients a year. There are 100,000 patients in America. That will take 1,000 years just to do the patients right now.
Wow,
And
that's
gene
very
therapy
cool.
is 2.2 to $3.2 million, whereas a home oxygen concentrator is 400 to $3,000.
Wow.
You just need that in your house.
Yeah. So is it something that,
Literally.
yeah, wow, that's a very interesting. And it's like, kind of goes back to like, and when you look at like how this is a solution for sickle cell, you just think about some of the other like chronic, you know, um, diseases out there like yeah, diabetes or and stuff like that, or others that made that they haven't really came up with a solution yet. And when you think about it, it's like maybe some of those other ones have a simple solution like this one, where it's like, yeah, just use a home oxygen, and you're able to take control back. And then maybe in some of those other, I mean, outside of diabetes, maybe like with high blood pressure, there's probably something out there that someone really hasn't figured out yet, that's, oh, like this thing right here can actually give you control. I mean,
Well,
outside of taking drugs.
so the key is returning control to the patient, because right now, the present way sickle cell is treated is that people wait for the patient to get into a crisis and go into the hospital, and the whole cascade of complications starts right there. But for the first time, we've given control back to the patient.
Right.
Yes.
The patient can prevent their crisis, and they
Mhm.
can stop their crisis at home. And they don't have to go to a hospital where a doctor there is going to mistreat them or abuse them, not give them the pain medication they need because they're claiming they're drug addicts, and just make them suffer. And I mean, we've lost patients in our WhatsApp platform the last few days because the doctors were using old drugs like pentazocine and tramadol to control the pain. And it was a very terrible pain. Only the pure opioids, morphine, fentanyl, dilaudid, pethidine can combined with anti-inflammatories can control that pain. So the key is if the patients can avoid going to the hospital, because even here in America, they go to the hospital, they give them, even when they're using pure opioids, they give them just too little because they're worried about addiction. But what you're worried about addiction, but dead people don't have addiction, are not addicts. So the patient dies, well, then what the whole issue with addiction? So here, for the first time, they have control. They can take control of their illness. And going to the hospital would just be rare and infrequent.
Wow. So it needs to be a full-on campaign about
Yeah,
this,
it
like
has to be a campaign.
constantly marketing, campaigning about this, letting people know, because people need to know, like how, I
And
mean,
the data,
it's
and the difference too, and I think what will help with that too is the data is consistent. So the
right.
data's there.
Yeah, the data is there. Unfortunately, nobody's going to make money from home oxygen. So Big Pharma is not going to come and provide the money for a campaign. So all we can just do is continue to spread the word,
Yeah.
social media.
Mm-hmm.
And you know what? And then even in Nigeria, some of the doctors there are trying to do some trials using home oxygen.
Mm-hmm.
We encourage doctors everywhere in the world, use home oxygen and compare the rate of crisis before and after, and
Right.
publish it. In fact, we have the protocol on our website. We have a lot of materials on our website, and you can put it up in the broadcast, sicklecelldiscovery.com. If you go
Yes.
there, you can see all the materials, and there we also have the link to a sickle cell WhatsApp platform has right now 988 members. It
Mm-hmm.
started just 6 months ago.
Wow, that's huge, doctor. I know I checked out your website. It's amazing. It's like it's a one-stop shop on your
Yeah.
website. And
Which
so,
which
yeah,
website?
the
The sickle.
discovery,
Yeah,
I went on there and you have the oxygen concentrators on there, the ones you recommend, and how you can get to your podcast, how can you watch your videos and all of that. So kudos to you for that, for just having a one-stop shop for people to actually go on there. So and so they can get that information, because it's definitely something that needs to be, people need to know about it. I think about the young lady in oh my gosh, TLC. She's
yeah.
a singer. Yeah, one of the singers of TLC. I know she suffered from sickle cell. And so when I was looking at that, I thought about her, because I remember when they were doing a tour or something at one point, and they said that she had she had some issues going on and things like that. And so yeah, it's just something that people definitely need to know about.
That is true. They need to know about it. We need to blow up. We need some influencers with millions of followers who
Yeah,
can look at these videos and, share the knowledge. Knowledge is power, Tara.
it is. Oh my God, knowledge. Whew, it is, doctor. Knowledge is definitely in
Knowledge is
every
power.
aspect of life. Let me tell you, in every aspect of life, knowledge is power. It is definitely critical. So, oh my God, doctor, I want to thank you for your time because I know you are very busy and saving the world here with the sickle cell and pain management. And so, for the listeners out there, why don't you just give us some information, give us their full website, how they can get a hold to you, if they need to do some consultations and all that good stuff.
Yes, everything is on sicklecelldiscovery.com.
Okay.
Sicklecelldiscovery.com, one word. And you can reach me through the link there. You can access the WhatsApp platform through there. And that's it. And all the materials are there, the videos, podcasts, text, different things are there. And Tara, so thank you for this podcast. I hope you can broadcast it and let people know.
Oh, yes.
For sure, yes.
Save you from organ damage, from hospitalization, from complications of the disease. Just a simple home oxygen.
It's a simple home oxygen. My goodness, I tell you.
And then I have the last question too. So like when you were talking about like the airplane, situation, that's a huge one because like, I mean, I'm like, so it's like people with this, they can't, like, they're probably afraid to fly.
They're afraid. Well, most of them were flying without the knowledge and they ended up dead or having a crisis when they got to their destination or even inside the aircraft. So some airlines will provide supplemental oxygen on request, like British Airways and Air France. But airlines in the United States, they used to provide supplemental oxygen before, but now they require patients to buy their own portable oxygen concentrators, which can cost, for those ones that are FAA certified, you're looking at $2,700 to $4,000 with all the batteries too, which is just a system that has to be changed. I've tried to communicate with the Department of Transportation over the last 10 years, but I've not found anybody ready to move the needle on that to make them begin to offer supplemental oxygen as they did 20 years ago. But yes, it's that air travel is a very dangerous travel for patients with sickle cell without supplemental oxygen.
Wow.
Yeah, because we think about that too, because like even for like and that's interesting too, because like even for airplanes, like if you had a surgery and then they talk about how you have to use compression socks because at certain elevations it can create inflammation or exacerbate it.
Yes, that is true. And unfortunately, the ignorance for sickle cell anemia has been just astounding. Even the National Institute of Health advice for patients traveling by air says they should wear warm clothes and drink lots of fluids.
Oh my God.
And I just can't imagine the level of ignorance. I don't want to attribute this to an African American illness, but it's really unfortunate. But I've come to bring a light to the darkness of 7,300 years.
7,300 years. Well, oh my goodness. I have learned so much today. Doctor, thank you for sharing this. We definitely will be sharing this and talking about it. And I've learned a lot today. And it's definitely heartbreaking because I mean, when you talk about pain, I couldn't even imagine that type of pain. I had sciatic. And I was almost on my knees from sciatic. I can only imagine with your joints,
it's like I imagine like that pain would be something where like your whole, like your organs, like your everything is hurting at the same time.
And like 100 times worse than your sciatica.
Oh my God. I don't even
and worse than labor pain. There's no other pain a human being can suffer more than the pain of sickle cell crisis.
Oh my God. That is it. And so you actually, with the pain management, so basically with the pain management, what you do, is that like injections or something? But you don't even visit with that any longer. It's pretty much just based on the oxygen.
Well, the oxygen stops 90%. So the rest of it is 10% if they have infection, or in the developing country they have malaria, then they have to go to the hospital because they have to get IV antibiotics and IV pain medications. Because oral medications, I do give IV pain medications in my clinic, but I'm not an ER. I can't keep patients for 24 hours. So
Right.
it's better off to go to the hospital.
Oh my goodness. And then that rate, and so, and that's the thing too. Like, I mean, when you think about oxygen, as you mentioned earlier, doctor, and the admissions and what it costs to be in a hospital or even going to the ER, you literally can save money if just to pay, if you even the insurance company or they had some type of donation or whatever that can donate it to the patient when they have these type of crises or they have sickle cell, would save would save so much money in the
Well,
healthcare
you've seen the
alone.
statistics, $811 million
Yes,
the year 20.
811
So
million.
if the insurance companies knew better, but they don't, they'll pay for home oxygen because that will save them hundreds of millions of dollars.
Yeah, and you think about it, and,
Yeah,
the crazy part about that is, doctor, it could be a one time because they just need that portable, continuous flow
continuous flow.
concentrator.
Yeah, that lasts 3 to 4 years.
Wow. And then you don't even need the stationary like that. I
No,
mean, unless you're at
yeah,
home, but
I mean, that is just, and I would definitely recommend the portal. Would you say the portable would be good because when patients are traveling or or
Well,
yeah,
yes, but if they can't afford the portable, at the very least, stationary, and
yeah,
the very, very least, just an oxygen cylinder that needs to be refilled every 3 to 4 months.
okay.
wow.
Do you guys provide oxygen cylinders?
We don't, but we have a company we subcontract to
Okay, good.
for cylinders.
Yeah.
We do. So if you ever, yeah, we do have companies we sub
We
it
have
out
the
to.
portable that we do
But we do the
the
portables
portable
and the
continuous flow as
stationaries and
well.
continuous flow. And actually we have a brand that it does continuous flow and pulse dose.
At the
Yeah,
same
we advise patients not to use pulse dose. Patients
Right.
with sickle cell should never use pulse dose. It's not effective. It will not prevent or stop a crisis. It
So
has to be continuous flow, at least
uh-huh.
1.5 to 2 liters per minute.
Okay. Okay. Wow. This
And
is
then
anything.
also it's like when they're using the oxygen, is it like a certain time of day that person would be more likely? Is it better to use it? I'm assuming like you were saying that at night when you're asleep that's when the crisis is at its max. So is it better just to use it more so like okay, you will use this oxygen at nighttime or right before you go to bed?
Well, yes, they can use it at night if they've had a stressor during the day, and they can use it for 1 hour, 2 hours, 3 hours, or sleep through the night with it. There's no toxicity from nasal cannula oxygen. And then also during the daytime, if they start to have a crisis or if they wake up in a crisis and they didn't sleep with the oxygen, they can just turn on the oxygen. The oxygen needs to be at their bedside so they can put it on as soon as they begin to have symptoms.
Goodness.
Wow.
Wow. Whew. Knowledge is power.
Just power, yeah. And it's like,
Oxygen.
and it's just like, and with I was like I was saying like before, like, I think the good thing about this though is that it's something as simple as oxygen. It's
Yes.
not something that like you have to get a certain type of surgery or something like that, or injection that you have to do to yourself over and over. It's more so like yeah, you just put the oxygen mask on or in periodically throughout the day, and just go from there.
Yeah, they're not even a mask. They just need a cannula.
The
Oh yeah,
canyon,
cannula, yeah, the
the
cannula,
nasal
yeah,
can,
the
yeah.
nasal cannula, yeah. So
Wow.
Yeah,
you,
that's all they
yeah,
need. Yeah, it's a very simple solution.
Simple
very simple.
solution.
Wow,
Wow. My goodness. Well,
that's amazing.
again, doctor,
Yep.
thank you for your time. Thank you for all this great information. We definitely will be sharing it and having more conversations about it. And we got to do this again because we want to just keep the word out, right? We want to just share as much as we can and talk about it. And so, my goodness, thank you again. And you guys heard it right here on the medical equipment world and healthcare. Get the scoop. Dr. Sota. I love it. Oh my gosh. All right,
Thank you.
Doctor, any last words that you want to say to the audience?
Let oxygen be your medicine. Thank you.
Ah, there you go. Enough said.